throughout, and they are there and they keep fighting. Thank you so much for joining us. And I would like to now proceed to invite the panelists to introduce themselves by telling us their name, their specialty, and where they work. Let me start with, in no particular order, Dr. Makove Wala. Dr. Wala, please.
Thank you very much, Stanley. Good evening, everyone. My name is Dr. Wala Elizabeth. I work for AMREF Health Africa as the Program Director for Health System Strengthening. And yeah, thank you.
Thank you, Dr. Wala. You can give Dr. Wala a round of applause virtually. Next up, Dr. Collins Ochieng. Dr. Collins, please.
Thank you, Dr. Stanley. Good evening to everyone. My name is Collins Ochieng. I'm a consultant surgeon at Port Reitz Sub-County Hospital, Mombasa. Thank you very much.
Thank you very much, Dr. Collins, all the way from Hospitalia Machizi, as I have heard it called. Next, Dr. Jack Irungu.
Good evening all. My name is Dr. Irungu Karoga. I am a medical epidemiologist. I'm working with the National Rapid Response Team on COVID-19 under the Ministry of Health, Public Health Emergency and Operations Center. Thank you.
Thank you very much, Dr. Irungu. And next up, Marilyn Chesang. Sorry, Marilyn, you are mute. Please unmute your mic.
Can you hear me?
Yes, we can. Thank you. Proceed.
Yes. Good evening, everyone. My name is Marilyn Chesang. I'm a clinical officer. I work in a health center called Ngara Health Center in Starehe Sub-County in Nairobi.
Thank you very much, Marilyn. Next up, Austin Oduor.
Thank you so much. I'm Austin Oduor Otieno. I'm a clinical officer. I'm the president of the Global Association of Clinical Officers and Physician Associates. I'm also the National Deputy Secretary of the Kenya Union of Clinical Officers. And I'm based at Migori County.
Thank you, Austin. Thank you very much. Next, Zedi Comment.
Good evening, everyone. My name is Eddie Komen. I'm a registered nurse. I work in Kenyatta National Hospital at the Infectious Diseases Unit. I'm happy to be here to share more and maybe learn more. Thank you.
Thank you very much, Zedi. Dr. Joy Mugambi, could you assist me in introducing the remaining segment of the panelists, which is the experts on mental health? Thank you, Joy, take away.
Thank you very much, Dr. Ariaru. Our mental health experts on the floor are quite a number of them, but we have Professor Lukoya Atwoli, who is a very well-renowned mental health expert. He will be telling us more shortly. We have Susan Ruturi. Susan Ruturi is a nurse at Kenyatta National Hospital. She is also a counseling psychologist and has been handling the health workers who are in the isolation center at the Kenyatta National Hospital referral. And we have with us Catherine, Dr. Catherine Gitao, who has actually shortly done some debriefing for this team. We have Sophia Morioki. We have Yvonne Orlando, who was here with us a few hours ago. We have Liz Ahemba, the clinical psychologist of Kenya president. We have with us Dr. Somba, the chair of Physician Wellness Committee of Kenya Medical Association. And we have Dr. Tonya Shaw, who is also practitioner in current surgery and is also a counseling psychologist. Our president, Dr. Were Onyi, is here with us. Diana Marion, who's our Assistant Secretary General. Past President, Dr. Kitulu Jacqueline, is here. And one of our clinical psychologists, Rachel Maina, is also here with us. So welcome all. It's exciting to see even our attendees on the other end. I'm honored to have my Africa President, Professor Shabir Mosa from Wonka, Africa. So Africa is here with us also tonight to hear the stories, because they also are sharing the same issues that we are sharing as Kenyans on our end. So all the way from South Africa, welcome, Professor Shabir. Thank you. I hand back to you, Ariaru, to take us through our first panelist questions, and we hear what they have to share with us tonight.
Thank you, Joy. I have shared the questions and the rules of engagement with the panelists, and I'm sure they are all patrolling to go. For the rest of the audience, as Dr. Mugambi said, please feel free to type in the chat or the Q&A segment, and we will collect some of your questions. Thank you. Now, to our first question, in no particular order, I will take this to Marilyn. Marilyn, if I remember,
Yes.
Your story supersedes most of us as healthcare workers, because we think you are the first healthcare worker to get this COVID-19. Please briefly tell us how it felt right from the diagnosis and how you handled it.
Thank you. I think I would start from the day I went for the testing. I really took myself because of a patient I had seen. I'd traveled outside the country. I'd actually come into the country 3 weeks prior. And I took myself because I wanted to protect my family in case I had it. But it was not in my mind at all that I would possibly test positive. And I went in on a Sunday evening. No, it was Sunday afternoon to the Mbagathi infectious diseases unit. And we were held there for a while because of the protocols there. And finally, we were tested at around 4. And we were told that we will be held in there until our results come out the next day, which was a Monday. So we slept there and we were chatting with the people we were with, and it did not occur to me that I could actually test positive for whatever reason, because the ladies that I was with in the same dormitory, I would call it, most of them had come from outside the country. And their suspicion was very high, because somebody would say, me, I came from Turkey, me, I came from UK. And this thing had just come in the country because that was a second week from the time they announced the first case in Kenya. So to me, it looked very far. And on Monday, now when the results came in bits. The first results came around 11 for the men, because where we were, the men were sleeping down as we were up. So the results came up for the men at around 11, and there were, I think, 7 men, and my husband was among them. So the results, when they came out, the 6 results for the other men came out, and I think 3 of them turned out to be positive, and they were told to move to the other side. And the other thing, the 3 were told they were negative, so they go home. So for him, he was told his results were not out. And to me, that was a very big question mark, because what a coincidence that it was only him out of 7 men that the results were not out. So we were still waiting for the ladies, and we kept on asking. Every time we were seeing a health worker walking around, we would ask, where are our results? And they would tell us, not yet out. So we were questioning, but not yet out, how? And we were done for the same day with these men whom results had come out. So around 1, I kept on pestering him whether he had gotten the results, and he looked like he did not want to tell me the truth. But around 1, he told me, by the way, my results are out and they are positive. And that shook me. I could not go and tell the other ladies we were with that the results had come and actually his was positive, because to me that was almost suggesting automatically I was also positive. So at around 5 in the evening, the results for the women, the ladies came. Actually before, yeah, so when they came, they were told, you are positive, you are negative. So the people whose results were positive, there was some red arrows pointing towards the other side of the building that actually were going to the isolation. So we are just told, follow the arrows. So I think I'd gone down to, I can't remember what I went down to do. And the nurse who came to tell me the results told me, actually she never told me the results. He told me, what is your name? So I said my name. And he said, follow him. So I followed him now towards the red arrows. And you can imagine what that one meant, because I was not shown any results and told, these are your results, and it is like this. I was just told, follow him. So I followed him. And we went towards the red arrows. And you can imagine red arrows, what it would mean even in anybody's mind. So we went to the other side now where it was the isolation, because this other side was the waiting. And to me, it was a shock. It was unbelievable. I was asking myself, why me? We are so many health workers in Kenya. I do not work in a big facility. And here, I've been diagnosed as a positive patient. So it was something that was not easy to take. And I would say it took a toll on me, especially the first few days, because nobody was explaining anything to me. Nobody was telling me anything. And all my life I've been seeing patients, and now I am the patient. And I'm wondering, you mean these people cannot even come and tell you it is okay, that you don't worry, things will be well. So we struggled with our own issues. We cried the first few days, and we kind of comforted each other, because we were in this thing, we were locked somewhere, we could not see outside. It was only now the people you are with. And I think we used to meet the men when we are going for meals. Otherwise, we were in a locked place, and you would actually not see, you would only see the nurses coming in the morning to take our temperature and ask us whether we had any issue, and they go, and they would take their shortest time. And in the evening, they would come, take the temperature, ask us whether there's any problem, and they go. And most of the time of the day, we were on our own. So I think it was something that was a bit heavy and actually confusing.
Wow, sorry about that, Marilyn. As we said, we have experts here who should be able to support us, and that is what is going to happen. Joy, please, would you like to pose the next question to the next panelist?
Thank you very much, Marilyn, for sharing that. It's not an easy journey that you took. You were diagnosed at a time when we didn't know what to do with COVID, and we really didn't know what we were doing. And I know it must have been tough, but you're sharing the journey, and we are learning, and we hope that this also is part of healing. So I pose my question to Jack Irungu. Jack Irungu is a medical epidemiologist. He has been in the National COVID-19 Rapid Response Team. And as a frontline member of that Rapid Response Team at the national level, tell us what it entails on a day-to-day, from the time we started with the COVID response, on your work on COVID.
Thanks, Joy. So in the National Rapid Response Team, basically what we've been doing is responding to alerts that have been raised to the Ministry of Health. Majority of them through the 719 number that I'm sure majority of us know. So once the calls have been filtered out, they filter out that the call that require a response through the Emergency Operations Center, through the Ministry of Health. And from those, we confirm the information. And from that, a team is usually sent out for the alerts that warrant any intervention. So what happens is that we have a number of rapid response teams under the Ministry of Health. These are the teams that actually go out to the teams, to the households of the community to conduct investigations. So each team is composed of about 2 to 4 persons. And once they receive the information from the RRT commander, they go out. They go to households, they go to organizations, basically anything like that. So when we receive any suspected alert, a team assembles and goes out. And we go and collect the samples, take them to any of the labs within Nairobi. So the counties that the National Rapid Response Team have been giving the services to have been Nairobi and the surrounding counties, Kiambu, Kajiado, sometimes Machakos. So we go to the field to people's households, interview them. If they meet the case definition or the team feels that these persons warrant testing, then you collect the samples. Of course, after you're done, and we have the so-called zombies that have been visiting people's home, but not those that forcefully collect people. But basically the team that actually conduct the testing, get the samples, and then take the samples back to the lab, and then ensure that the result get back to you. So from actually as far much as January, we have had a rapid response team. And at that point, largely we were stationed in the airports and the point of entries, conducting screening and that kind of thing. And then by the time we got our first case in March, then we started going out and actually conducting the testing largely within the quarantines that had been established. At that point in March, mostly there were hotels where most of the persons flying in were being placed under mandatory quarantine. And then we began getting community cases, so that meant we had to go out to the residential estate.
I think we will, I'll hand over to Dr. Ariaru to take us through the next panelist, and then we'll get back to Jack once he's back on
Salas
network.
coming from the high end, sorry, yeah, so and then it changed to the middle and then the lower level settlements. So that's what we've been doing, going out to people's households, investigating them, and basically collecting.
Thank you, Dr. Irungu.
In addition to...
Thank you, Dr. Irungu. Sorry, we're having an issue with your voice. Allow us to go to the next panelist. We'll come back to you. Sorry about that. Next question will be to Dr. Collins Ochieng. Dr. Collins Ochieng is a general surgeon in Port Reitz. Dr. Ochieng, tell us about the experience you had from suspecting that you could be having COVID-19 to going for the testing up to receiving the results. Thank you.
Okay, my experience is a bit different because I actually didn't think I had COVID when I went for the testing. They were doing mass testing at the time, so I just decided to go for it. But a week or two earlier, I'd had some headache for 2 days. I used some antipyretics, then I was okay. But after the testing, which was like a week after that, I got my results like 1 week later. And the way I got my results is what like pulled me down. It affected me somehow emotionally because people I would say, let me say everyone in the hospital knew my results, but I'd already not yet been told my results. So after I received a call from one of my colleagues who was at work at that time, telling me that they have had people discussing me in my absentia. I said I would wait for an official communication today from my bosses. Then I got my results from my boss, like I would say 6 hours later. Then I would say like like in 24 hours later, I started receiving calls from county bosses, from the ministry, telling me I have COVID, I need to be isolated. They were just pushing me to tell them the contacts, but nothing much on my well-being. So, but I actually cooperated, gave them all the contacts. Then after 2 weeks, I think it was my turn to be tested again, like the second testing, which was done after those 2 weeks. The stressor here was that I had to look for someone to come and test me because I was at home and there was no follow-up from the time I was given my diagnosis up to the time I was looking for someone to test me. So I actually had to call people, look for someone who would be able to come and test me, which was done, and hopefully my results turned negative. So after that, I'm still receiving calls 1 month after I was diagnosed. I'm okay is when I'm still receiving calls from the ministry asking me how I'm doing, and yet all along they have not been following up from the time of diagnosis. So you find these are the things which also like keep on reminding you of what had happened earlier, and you didn't want it to keep on happening to others. So those are some of the things that need to be looked at.
Thank you very much, Collins. I think that's an indictment on us and something for us to reflect upon, that the results of a patient can be known to other third parties before that particular patient knows them. Joy, please pose the next question to our next panelist.
Thank you. Our next question goes to our lovely friend and health advocate,
Sorry, Joy, we
Dr.
can't hear you. Please unmute.
Our next question goes to Dr. Makove Wala, my friend and very good advocate of healthcare within the country and outside the country. Tell us how you learned about your COVID test result. I remember that day you woke up and we saw your post and we were all panicked. And I kept asking myself, when did I last see Wala? So welcome.
Thank you very much, Joy and Stanley. I think my situation is a bit different, being more on the policy side. I wouldn't say that it is from a clinical setting, but we were following up on the demise of our Dr. Doreen Lugaliki, and that meant quite a number of meetings and just supporting the family, because believe it or not, unfortunately, the family did not receive some support from the government in terms of people actually coming to mourn with them. So when one of us tested positive from some of those gatherings, at the time, I was just feeling okay. And then what happened is the person, I interacted with the person like 4 days before their results came back to us. So wherever the person went to get tested, it took quite a while, like 4 days for that. By then I was having a flu, feeling very bad actually. I was in bed the whole of Friday of the other week, 2 weeks ago. So I reached out to my colleagues at Cambridge and narrated the situation, and they were kind enough to bring a team that tested the number of people who are around that person. And our results came out the next day. at night. I remember it was 9 p.m. and I'm having a call with a friend, and then I see on my WhatsApp the results. So that really stunned me because I had interacted with some family members that were immunocompromised, and that was my biggest worry. I had interacted, of course, with my children and with my house manager. And so that was a big concern. So processing the news, I took the whole night. In fact, that night I couldn't sleep. I felt, in addition to the flu symptoms that were there, I just felt like I was running short of breath. I think there's a lot of psychosocial issues. I felt like someone was sucking out my breath, not that I couldn't breathe. And I had to stay awake because I feared waking up dead. I don't know if that makes sense. So the night was quite long, and also during the day. So I broke the news to my other family members and a few friends who are close. And then someone challenged me. They told me, you know what, why don't you document your journey? Why don't you share with others? Now, that was a difficult decision to make because one, it meant being vulnerable to the public about my status, but also in a way, having a way in which I could protect the confidentiality of the other people who were part of the team that were tested. So I put up a post and generally just put out my journey and said, look, this is the situation. I just need to talk about it. One, I like writing. That's my form of releasing my emotions. But two, having interacted in terms of policy level, I know the kind of policies that have been passed have not been very friendly to people who are tested positive for COVID-19. We've not handled them with dignity. We have created so much fear in terms of people being put in quarantine. And so that has led to quite a number of people not disclosing their status. So coming forward was a way for me to just let it be known that it's okay to be positive. It's not that it's okay. It's okay to say that you're positive. It's not. It should not be stigmatized. That's the word I'm looking for. And I remember even within our estate. So the story got to the estate WhatsApp group, and I was afraid because that would mean stigma from the people around me, but the reception was very positive. In fact, people were very concerned. They wanted to come in and support in terms of providing supplies and stuff like that. So I have received quite a number of calls. I've been called by policemen who are positive. I've been called by doctors who are positive. I've been called by even colleagues who have relatives who are positive. So it just means we need to talk more about it. We need to demystify it. The home-based care regime, we need to look at the policies around it because it's not possible. Some of those things that we're supposed to do are not practical for many, many households. So how do we speak out about this? How do we say, look, maybe we need to adjust on this and that, and maybe we need to be more lenient in some of the measures that we've put in place, because it's easy to write policies, but then the implementation is a totally different game. So I'm here, my symptoms are resolved. I have seen that there are new guidelines that are talking about not retesting, and that one stops shedding the virus once the symptoms resolve. So I am really crossing my fingers that I don't have to go through another test. It's not funny to have that test. But also just to find a way in which I could, people are really suffering, let me put it in that way. People are suffering silently, people are very, very scared. So we need to handle that issue of the fear and the stigma. Thank you.
Thank you very much, Dr. Wala. Thank you very much for sharing your story. Let me go to our next panelist, Zedi Komen, nursing officer in charge of what has been dubbed Ground Zero at the beginning, the Infectious Diseases Unit. Zedi, When your unit was designated as the isolation facility, we saw challenges with PPE provision, health worker training, etc., etc. How was it being a staff at that moment when no one seemed to be ready to take care of COVID-19 patients? Tell us the challenges you may have come through, both as a person and as the institution you lived. Zedi.
So thank you so much for the chance and giving me this platform to share my experiences. But first, before I share, I would like to say thank you to everyone who is here and listening. And more so, thank you to Marilyn Chesang, because she was under me at some points, and now we are meeting here, outside here, on the same issues. And I think she's very courageous. And I would like to apologize in case of any wrongs or any weaknesses that we didn't manage to the standard. Okay, so back to me. At the beginning of this journey, it was not easy. It was full of anxiety, full of fear. And personally, I was with a team who had gone to West Africa, and we looked like we were the ones who know what to do. And we were the ones who were brave enough, and you know, we were running the show. So issues to do with IPC, issues to do with how to don, doff, and so on, we were taking the lead. And though we were doing this, we still had a lot of anxiety, and we still had a lot of fear while we were managing these patients. But at that point, we were facing so many challenges. Remember, we didn't know what to do. The systems were not clear, you know, things, we were starting to do things with the limited resources and so on and so forth. So we had so many challenges, but I thank God that we managed to where we were. So personally, while I was working there from February, March, until July, this month when I was tested positive for the same, I used to be on the front, taking care of my staff, my colleagues, you know, making sure everyone is safe. It was really very interesting. And because I used to make sure, I want to see when people are going in, I wanted to make sure that they have done well. And I was asking them if they are okay, I was labeling them and so on. And I was very keen in monitoring my staff, telling them if they are not feeling well, they need to report and so on. But I knew at some point I would be a victim. And the good thing is, having gone through all this, I've had the chance to see many clients and many patients who've come in, tested positive, and went home. But then again, we still had patients who succumbed, and there was still that aspect of fear. But hey, I was the strong one now, and I was the one to, you know, keep the team going. I used to get calls from all over on what to do, how to do things, and so on. And so let me say my time came. And every time I used to have maybe a sore throat or an headache, I was thinking maybe, this is the time now I have COVID. So I remember on 6th of this month, on a Monday, I was not feeling so well in the evening after work. So I came home, I was feeling, I had a headache, I was feeling so cold, I was feeling tired. So I took a shower and then I just slept. I didn't even take supper. because I didn't feel like I had the appetite to eat. So come the next day on Tuesday, I was not feeling so well. I had chills, I had muscle pains, I was feeling weak. I had all those signs of malaria. And I said to myself, wow, this is the day now. But I went to work. So I went to work and I was telling my colleagues, I think I need to go and do the testing. So I went to do the testing, and while we were waiting for the test, I remember some of my colleagues who are waiting to be tested. Some of them were telling me, wow, if the hero is here and if she gets COVID, that means all of us will get COVID. So I was telling them, by the way, no one is safe from getting COVID. And I wouldn't say I know how I got it, because I used to make sure I'm safe. I used to make sure my PPE is in order and so on. So I tested and the waiting started. So I went home that day because I was not feeling so well. And I took an off the next day. And then on Thursday, I was feeling a bit strong. And I decided to go to work because there was an activity that I was yet to perform. And I was with that team. So I went in, we were doing PPE clearance, because we were checking on the right PPEs that were supposed to come in to the hospital. And by around 11 there, I was feeling in my heart that there's something wrong with me, because the muscle pains were not going away despite taking the painkillers and so on. There is this headache which had come in, and I was feeling a bit unwell, but I remained strong. I didn't want to tell my team that I was not feeling well, but I tried to keep safe from them. I remember we took tea with them, but at the back of my mind, I was saying, oh my God, let me just maintain the 1.5 meters away from them, just in case. So 1 hour later, I got the news that I was unwell. I had tested positive for the virus. And now it was my turn to go. So immediately, the first person who gave me the news, then I started receiving so many calls. The news had spread, so I received the calls, people asking me, are you okay? Are you sure you're okay? Are you sure you will go home? Do you need any help? You know, people are really concerned. And that kind of concern really kept me asking myself, am I really okay? But I was okay. So I walked home, I went home, and I informed my family that the results were out, and this was the plan. This is what was going to happen. Now I'll stay in my room, and so on and so forth. So my journey has been with many challenges, full of anxiety, but at least I had a lot of support from my team, from my family, and from my friends. And just to say that there's a lot of stigma, and people will not know how they stigmatize you. But the moment they start calling you, and maybe the questions they ask you and the way they ask you those questions, the way people look at you when you, for example, there's a time I went out to hang my clothes, and you know, when I meet someone on the way, you know, I forget that I have COVID. So, but I have my mask. But the moment that maybe I try to say hello, I remember, oh yeah, no wonder. That's how they are behaving. So stigma is there, and I guess we need to talk about stigma, and we need to help each other so that we can demystify this stigma. Yeah.
Thank you very much, Zedi. I recall we were with you during our very first psychosocial support meeting at NNAK, and you are looking healthy, and you still do look healthy. And we appreciate the fact that you're sharing with us your journey and the mishaps that have happened along the way. And I feel, yes, we need to do more in terms of psychosocial support. We need to do more in terms of staying alert and being able to share our journeys. I move on to Austin. Austin is from Migori.
Okay.
Welcome, Austin. I hope you have arrived home and you're not driving. So Austin, your journey with COVID has been unique because for you, you're from a rural facility, and being in a rural place, how has it been having COVID in the rural places? Because there has been a lot of challenges with the communities within the rural areas. Working in a rural remote, have you faced stigma from the community and colleagues? How has it been since the time of diagnosis?
Okay. So I would say I'm from Migori County, and all of us know Migori County borders Tanzania. So Kuria East, Kuria West, those sub-counties within Migori County borders Tanzania. And all of us know that the point of there's a lot of interest at the border points. And Sirare, which borders Tanzania and Kenya, started recording numbers from Migori County. I used to work in one of the facilities near the border, around 10 kilometers from the border, but not Sirare. It's on the other side next to Narok County. So cases started skyrocketing. Kuria West started recording. Isibani out of the Sirare border is in Kuria West. And most of them were truck drivers from Mombasa, from other countries. And they used to move in and out. So the first cases were reported in Kuria West, and they erected a quarantine center within Kuria West. And the only isolation center that is in Migori County is found in Nyatike, which is towards the farthest place next to Homa Bay County. So those who tested positive were being taken to Nyatike. So here, Kuria West, they erected that quarantine center, and there was another one in KMTC, Keancha, which is still in Kuria West. So there's a case that was reported in my sub-county because I work in the sub-county hospital. So that case prompted the health management team and the county government to get a quarantine center closer to my facility. But what they didn't do right was that after putting that quarantine center, they only put a one public health officer and around 6 community health workers. There was no clinical officer, there was no nurse, there was no medical doctor, there was all those people were not there. So around 14, at least between 10 to 14 were in that quarantine center. So what they were doing is, if we used to do rounds at the quarantine center, so the ambulance will come to pick us from the facility. That clinician or that nurse who is on duty will be picked by the ambulance to come and do a round. Not necessarily if there is someone who is developing symptoms, but just doing a round. So you will be called if there is someone developing symptoms at the quarantine, even late in the night. But the most funny thing is, you will look for, I will even search for a face mask, because we were not being provided with face mask. You are given a face mask, you use it for 3 days. So I will go with that. Even gloves was a problem. So we used to go, and you're the same person who check the vitals, the BP, the temperature. So they decided that, what we should do, let us train these clinical officers and nurses so that they can now be stationed at the quarantine center. So that day came. I was picked as one of the clinical officers, including other health workers. We went to training. the training was conducted at the same quarantine center. The person he was a teacher who had history of travel from Dodoma, Tanzania, tested positive. So that prompted me and 3 other clinical officers and a nurse to take a voluntary test. I had no symptoms. But a week earlier, I can say that there was some 3 days of marathon, headache, neck stiffness, loss of sense of smell, loss of taste, all those things. I even thought I had malaria. I did a BS, turned negative, took duocortexin against, in contrary to the malaria guideline treatment of malaria. This duocortexin was not even, there was no change. The neck stiffness, it was 3 days of marathon, but all of a sudden it stopped and I became well. So by the time I was taking that COVID-19 test voluntary, I was just okay. I had no symptoms. I was not coughing. So I took it on a Thursday with my colleagues. Results came on Saturday and I was working at night. So the way the news was relayed to me is what even shocked me, because I think I was suturing a patient and I was done with the suturing. Then one of the casuals comes and tells me, your phone is ringing in the house. Can you go? When I went, I found 30 missed calls from health management team, the MOH. Everybody was calling me and they didn't want. So I picked the one, the MOH's call, and the MOH told me, don't leave the facility. So I told him, why? Why should I not leave the facility? Because I'm clearing my night and I want to go. No, don't leave the facility. Is there any problem? Is my patient who is hypertensive not doing well? No, there was another patient again who was hypertensive and had a fracture. So that patient was supposed to be taken for some x-ray at the referral hospital. So I was asking, is this patient not doing well? No. So they didn't want to tell me. Then after 10 minutes, I insisted, tell me what is happening. Then we are sorry, Austin, you tested positive, the sample that you volunteered to do. Then I told him, it's okay. But the tension, I got confused. I left the OPD, told one of my colleagues to take over. Then they gave me time, something like 20 to 30 minutes, prepared myself. I was driven to the isolation center, around 200 kilometers from the facility where I was working. When I went to the isolation center, I found a laboratory technologist who apparently was the first health worker to turn positive in Migori County. He was stressed, I can say that. And because even he didn't want to tell people that most of the people who were calling him, he was referring to them, he was telling them that he's building at home. He's building at home. And even he had to put his phone on flight mode. So I could see that this person was lonely there with other truck drivers, those other people who also tested positive. So we were mixed. The only challenge that I think that will stress someone in that COVID isolation center is the feeding and the way you are treated. And as you were saying, the rural place where, I'm from the rural area, most of the people who are seeing us at the COVID-19 isolation center are my colleagues. Some of them are even people we are working with, we go with, we relax. So they were even shocked, and they're also like, the next time it will be me, the next time it will be me. So I went there, and I think I was the 50th patient, 52nd, I'm 53rd. But now, it was shocking that me and the other health worker, we didn't turn negative on the 10th day. As since they started the positive cases were being taken to the isolation center, all of them turned negative on the 10th day. So me, I turned invalid and turned positive. The other guy turned positive. So we were saying, why is it? Is it only us health workers who are turning positive? What is there? We were not taking it lightly. We were reading mischief, but again, in medical, we knew those are the results. But again, that tension, then we were removed from that isolation center where the isolation center that carried everybody. We were taken to a small room. I think it was one of the health workers' room. Apparently, that isolation center was a hospital. It was just changed. It's a sub-county hospital. It was changed to isolation center. So one of the staff houses we were put there. By the time I was leaving, we were around 13 health workers who had already contracted the disease, but now they had already come up with the issue of home-based care. So majority opted for home-based care. But I can say I took 21 days instead of the 14 days, because the 10th day I turned invalid, which they told me it was a mix-up in names. And then I turned negative on the 14th, on the
We lost Austin there. Thank you, Austin, for sharing your story. We will get you a chance to say a little more. Thank you, participants. The chat is in Kenyan Lingua Lit. There are so many comments. People are saying, this is interesting. These are interesting revelations pointing to our health services. I'm so sorry for you people for what you've gone through. Thank you for sharing. This is important in demystifying the challenges that healthcare workers are going through, and especially the challenge of COVID-19. Keep them coming. I will, in a short while, be asking Joy to look through the Q&A comments and pick 1 or 2 questions and post them to the panelists as a genuine question for them to respond. But before I do that, allow me to cross over to the panelists, to the experts in mental health, and I will ask my question to Professor Atuoli.
Yep.
Prof, you've listened, you've heard, you've read the comments. What is it that we are generally afraid of in a pandemic like this, be it COVID-19, be it any other disaster? What is the one thing that you would advise us to look out for, guard against, in terms of what scares us most, in terms of what raises our anxiety most? Over to you, Professor Atuoli.
Thank you, Stanley. And I want to first take this opportunity to thank our colleagues who have shared their experiences. Those are powerful experiences, and from the comments you're seeing in the chat, they are really touching the people who are listening, and people are starting to see the other side. You know, seeing somebody who has gone through this and is recovering or has recovered. It's an important thing, even for colleagues. What do we fear most? I think every living thing that thinks fears death. And this pandemic brings very close, because you're hearing that people have died in other places, you know, things are not going so well. So every time you found positive and you're a health worker and you've read this literature, there's this fear that, hey, what's going to happen to me? So that's natural, and it is something that everybody would go through if they're faced with a threat like this. And the good thing is that the health workers also have information about other outcomes and what happens to the majority of the people who get this infection and they get well and so on. So that might help to moderate that fear, but it doesn't eliminate it completely. The other fear that we have seen is the fear, like what Makove said. She's had this infection for several days without knowing, and she's been interacting with significant people in her life. The fear that you might have infected them and that they might have a worse outcome than yourself is real. And it's a fear that we really have to be aware of, and we really have to be ready to confront. The third thing in this context also is that once you're found to be positive, you will be isolated. You will be away from your family. You'll be away from your usual support system. You will disrupt your usual routine. There are things that you do, and people are afraid of going through something like this at this time, especially at this time when you're needed most by those that depend on you. It is a real fear, and these are real fears that we have to confront and to deal with. So I have picked this common thread from all the presenters, that there was this fear. So I knew I might get it because of the nature of my work, but then there was this fear that once I get it, what will happen to me? What will happen to my family? What will happen to the people around me? And there are actually publications that have been done from way back when this started in China, where they looked at what were your fears as health workers. And these same fears are the big ones anywhere somebody asks these questions. So in my view, in a pandemic, in a situation of uncertainty that poses a real threat of death or disability, those fears are real, and we have to prepare ourselves, and we have to support our colleagues who are going through this to start handling those fears as well.
Thank you very much, Prof, for sharing that. Yes, death arouses fear. I am so afraid of death. I looked at and asked myself, have I prepared my family adequately? If I go today, will my children have everything that I would have wanted them to have? Who will take care of them? All those things are going through our minds. And yes, family comes in. For those without families, you're still thinking, have I done enough to go? No one is ever prepared to leave this world. It's a beautiful place to be in. And we thank that sharing. On one end, to the panelists, I have seen this question going on even on our Facebook page. Are there times you have been tempted to go out? When you got the diagnosis, did you wake up one day, dress up because you had a meeting and found yourself at the gate? I can just imagine. Me, I'm a restless soul. I don't know. And I know Amakove is also another restless soul. How did you contain yourself from leaving that compound? I posed that question to Amakove because she's on home isolation. And we'll go around to the other panelists, how you have mitigated that challenge.
Thank you, Joy. It's a real issue. I think for me, my nanny was under strict instructions not to let me out. Maybe that helped. But there's also that aspect of responsibility where you know that you pose a threat to those around you or those that you interact. And the responsible thing to do is to stay, away from them. So that was a motivation, I would say. The other thing was I was also actually quite weak. So just giving my body time to rest, knowing that the virus and how it behaves in different people, you can't predict. So all you need to do is give your body the best shot at it. So that gave me the capacity to sit and be still. But that is running out right now, now that I'm feeling better, yeah. Thanks.
Thank you very much. I still ask from one end, yes, you have the symptoms, especially with Zeddy, who her test came positive while working, and she had the symptoms. How easy is it to share with our employers that yes, I am ill, and how was the uptake in terms of, yes, you're feeling unwell, we have a lot of staff shortages. How is that taken in our workplaces? Any of the panelists actually can answer that, because yes, we do get calls and you tell someone, ni kichwa tu, meza Canada kuja job.
Yeah, Zeddy, you can start, yeah.
Okay, so mine was a bit, I think mine was better because I have a very supportive team. And to me, I think my team were more worried about me. And especially when I presented myself to be tested and the symptoms that I had at that time. And so they were really worried. And even when they told me to go to work on that Thursday when I received my results, I think they wanted to monitor how I was. And I know it's not easy at this time when we have an acute shortage of staff. And it is not easy at all. Sorry, I just received a call, sorry.
No problem. I see Collins is on the screen. Collins?
Yes. Now for me, I think it's difficult, especially like in my setup where we don't have like a lot of workers to help you. So it might seem that you are trying to avoid work. So you would push on until you can't do it any longer. But since like for me on my side, the diagnosis I'd got it earlier and I was at home, it was the result. So I didn't have to go back to work from then because everyone knew about it even before I got to know about it. So that would play also some role in affecting you emotionally, having to think that you are going to leave your patients, who will take care of them, who will be working on the patient while you are away, because if you can't do it, then someone else has to do it. So like in our setup, our theater was closed and we even had to
I apologize, we have lost Collins. Dr. Irongo, I remember we lost you when you were making your comments. Would you just give a few comments in less than a minute, just responding to that general question? How is it to contain yourself when you are needed at the front line as a member of the National RRT?
Yeah, so thank you, Stanley, and the other panelists. Indeed, it's a challenge. I know last weekend I was doing, Sunday I was doing day 12. And I was in my house and I was feeling well, I'm okay. And I could not contain the room anymore. For those who can see, this is a bachelor pad in Nairobi, where I get to work when I'm out of, my family is in Nyeri and I'm in Nairobi. So I thought to myself, so I'm not exposing anyone and I have my vehicle here. So I hope there's no NIS here, but I took my vehicle and it had fuel, full tank, okay, 3/4 of a tank. And I did a drive. I went to one of the bypasses and I just drove. I drove and drove, went did a U-turn, parked my vehicle by the side of the road and just watched the traffic, watched the trucks going around, the guys doing their motorbikes, the guys doing their bikes. And for me, that was the best I have done since I was a kid. I remember when I was 5 with my brother, we would do this thing where we'll go and do by the roadside and say the next red car is my car. The next beautiful looking truck, whether it's Mercedes or whatever it was, is mine, and that kind of thing, those who understand. And for me, that was the best release I've had in a long time. So it may be considered careless, yeah, I want to believe that. But for me, I want to believe I exposed no one because I just walked from my house, got into my car. And for those who are wondering, we have had this thing, we have to sanitize our gate and a number of things that we have had to do at my place to ensure that we don't expose anyone, because sometimes I have to go out and pass the sun. So I just went and watched the traffic, and in the evening I get back, and then I went for a jog at around 9 p.m. when no one is going to jog in the estate compound, and I got back to my house. I want to say that I think our home-based care protocols and guidelines need to take care of some of these realities, because I think they also have to take care, because I think the emotional aspect, the psychosocial aspect of it is quite strong. Gets ignored by anyone. We only look at the medical aspects, the guys who have difficulty in breathing, the guys who cannot breathe, that kind of thing. They forget that these guys who are probably having mild symptoms or asymptomatic also has other issues to deal about, because I'm away from my family. My family is quite stressed. My spouse couldn't sleep for like a week in a row. And that's a big problem. So those are things that need to be taken care of. And yeah, I have broken the rules. I went out, but then I came back. I want to believe I exposed no one. I did everything that I could as an expert to ensure that I remained in my car and got back to my house. So really, I think that's all I have to say for now. Hoping that confidentiality will be maintained, and I'm not having any NNAK guys coming to pick me up for forced isolation at Mbagathi, which is not very far from where I live. Yeah, so that's it.
I can just quickly chime in and say you it's good to share that because there are many people who are probably going through the same experience. And there are many people who are doing probably the same thing. But the most important thing that you have brought out is the issue of responsibility, of ensuring that you are not meeting people, of ensuring that even if you're going, you're alone in the car, and that you are ensuring that the surfaces that you touch are sanitized. I think it is important for all of us to remember that it is that sense of responsibility that protects other people from getting infected. So I wouldn't want you to, go away stressed that, you did something so egregious, something so evil. It was something that you needed to do for your health. For me, the most important message is that we have to be responsible wherever we are to ensure that, we don't expose other people and also we don't put ourselves at further risk. So no worries about that.
Thank you, Prof.
You're mute, Stanley.
Prof, I was going to ask Susan to react to what Jack said. It sounded so sensible, so thank you for assuaging my feelings. Susan, please tell us what are some of the coping mechanisms that are generally cross-cutting that we can employ for these times that we are going through, the stigma, the anxiety, and the fear that all the panelists have brought up.
Thank you, Doc, and thank you everyone who has shared your personal experiences. It's very courageous of you, and we sincerely appreciate you for being so candid about it. How to cope? I'll use one of the acronyms that have been used by the Ministry of Health, that they say apple. You use apple to help yourself understand, and not apple the fruit, but even apple the fruit is healthy, so you can also eat the apple fruit. But A is acknowledge what is happening to you, like Dr. Jack has mentioned about his experiences, what he felt. He actually acknowledged he felt it and went on to take healthy precautions on how to deal with his emotions. Then take a breather. Pause. P is pause and breathe. So the example that, again, I'll use Irungu's example once again. He got out of the environment that was pushing him up and just take a breather from what is happening and pulling back, then let go. If whatever is happening, the stigma is you can't do anything about what other people do or say. So just pull back from that. You don't have to fight back. You don't have to try and justify anything. Just pull back from that, because you can't change. They have already communicated. They have already shown you what it is that they are experiencing. But E is a final one, where you explore with yourself what is happening, but also educate. Still on the E, educate the people around you about what is happening, and educating them about your experiences, that whatever they did is not right, and that you're taking your personal precautions to ensure you protect them. And they can also protect you by treating you well. Yeah, I think that's all I can say. Oh yeah, let me mention about children and coping with stigma. It's important to teach children from the level that they are at. Just get to know what do they know about it, and then demystify whatever it is that is wrong or not for their level, and then educate them why you're being isolated, if you have to be isolated, why you're being quarantined, so that they are not afraid and wondering, where is mom, where is dad, or where is my sister, where is my brother. So educate children from their level so that they can be able to understand what's happening to you. Thank you.
Thank you very much. Thank you very much. Joy?
Thank you very much. I truly, when I look at the chat box, it's on fire, just as Ariaru said. People are thankful for this sharing. We've been in an enclosed cocoon thinking this is a disease of Nairobi and it's of patients. But today we've heard from our colleagues who've shared what they've gone through, how they've managed it, and they are here. Yes, we are hearing deaths. We are healthcare providers. We see death every day. We manage, and we also manage patients who get out of our hospitals and they are healed and they are well. What we need to take home today is that fear is something we need to have living our hearts. Someone here shared her personal experience and said, as much as Dr. Irungo is saying, has said acceptance, it's one key thing. And yes, sometimes you might be in that enclosed space, they've faced it, they've had those challenges, and they've mitigated them by getting out. Yes, with a lot of caution. Get some sunshine. I work in a very rural place, and even where I live is also rural. We've attended to also private clients who ask you, I have been away, I need to get to my farm, I need to ensure that my crops are growing. Can I get out and go to the farm so long as I'm not meeting up with anyone? I don't know, the guideline is a bit tight, but we have flexed and ensured that we ensure that they follow precautions, because if you have a farm next to your house and there is no one else, they can easily farm so long as they are strong enough to do it and they are healthy. Those in quarantine and those in isolation, once they are recovered, can get out and get some sunshine in their compound, so long as they are not compromising anyone. I want to welcome our president. Due to time, we are at 8:23. We expect to be over by 8:30. I know there is a lot of comments and questions, but we will be back. We are always here on Tuesday. We will be back with more sessions. And I know, Prof. Atwoli, you have something to say before we welcome Dr. Were?
He speaks towards the end.
Yes.
So what I wanted to say is that I've seen a few things. People have asked about dealing with anger. I think it is important for us to go through that as well. Anger is one of the natural stages of dealing with this thing. Is dealing with loss, dealing with grief. After a stage in which you might go through denial, some people would go through denial, many of us would go through an angry phase. And when you're angry, sometimes you're even angry at yourself. How did I get myself into a situation where I got infected? How did these people put me in a situation where I got infected, and so on? So the anger will be there. Angry at the government for not providing sufficient protection. It is normal to feel like that. At a personal level, it is normal to feel all those feelings of anger, confusion, anxiety, and so on. What is important is how we deal with them and eventually start to find a way of coping and trying to rebuild our life, to live our life as normal as possible, even with the fact that things are not working as well as they should. You take on only that which you can handle. If you can't handle it, it is not your problem. If the government is not doing A, B, C, D, and so on, yes, the government is not doing it. Even if you take on that task and decide that this is my responsibility, it is not, because you do not have the capacity as an individual. So you can throw it at Joy and tell her, what are you, KMA, doing? You can throw it at the union, you can throw it at other people. But at personal level, you can sit down and say, I have done what needs to be done. I am at peace and I can move on and continue with my life, protecting myself and those that I love as best as I can. At an individual level, you have to reach that place where you say, this is not my elephant. These are not my tasks. There's somebody else for whom these things have been made. And for me, I have carried my own small piece and I will walk with that. That helps. It might not work 100%, but it helps at least to create perspective so that the anger, you can understand why you're angry and you can understand how you can go beyond that anger and make something useful out of this situation. And Amakove has found a way, and you've seen where she speaks about it in public. It's also a coping mechanism for her. It might not be for everyone. So I'm not saying everyone should now go and start blogging and doing what, everybody has their own way. Jack, you found a way of trying to be physically active and you know, bringing your mind back to the reality of the present. That is also a coping mechanism. I know some of you are communicating with your friends, you're calling, you're using this social media to communicate with your families and so on. That's also a coping mechanism. So do something that keeps you busy. Do something that takes your mind away from these big things that other people should be handling that have now come onto your shoulders. And that will be helpful. Thank you very much.
Thank you, Prof, for sharing that in terms of anger and how we can cope up. And thanks to our panelists. It was wonderful to hear from you. We will welcome Dr. Kivungu.
Yes, Joy. Good evening, Joy, and thank you very much. May I just say one word before we leave?
Yes.
I have listened to everybody, and I think this to me appears like it's a horror kind of movie or a story. Is actually very scary. A few things have come up. The issue of communication. I think we must know how we, proper communication to ourselves. Especially, we have heard that some of people are told other things before the countries is more known. So I'm saying that I think we should know communication so that we can pass this message very well. But more so, what bothers me is what's going to happen to the children who are left behind following the demise of our frontliners. And that's an issue that must be discussed because they're soldiers. And what I know is that if they go to the battle, knowing that the back is covered very well, I think they'll fight with a lot of more force than the fear that is there. Now, the children are left by that doctor. What are you going to do? Is the government going to take care of them? Is there insurance that is going to make sure that those children's life is not just messed up somewhere? I think the issue that we should look at now. As we go to the battle, is the back covered? And I'll just make just one comment about the soldiers here. When they go to the battle, a soldier is sure that the family will be taken care for the next 10 years. And they never die. What happens is that they say that they are missing in action. Someone is dead, yes, but they're missing in action. And then for 10 years, they're missing in action. And the family is compensated, given money for almost 10 years. Now 10 years is when they're declared dead. So the question begs now, what are you going to do with the people who have left their children or the families behind, or even the spouses or not, who are also of stress? That issue, I think that should be discussed. Yeah. Otherwise, then we go to the battle, our back is not covered, then the fear. Something happens to me, what's going to happen? So to me, I think that is it's very critical that as you go to the fight, the fear that we are going to leave people behind with nothing, it should not be there. Joy?
Thank you very much, Dr. Somba.
Well, I think that's very critical because you just can't have people fighting to die and leaving behind problems. So that must be addressed at some level. Thank you.
Okay. Thank you very much, Dr. Somba. Dr. Somba is the Physician Wellness Committee Chair, and we appreciate the work that he does in terms of supporting our physician wellness. Welcome our President, Dr. Were Onyi, and I know we have with us the current executive, Dr. Marion from Nanyuki. We have Dr. Kigondo, our Secretary General, and we have Super, our Treasurer, KMA, and our past President, Dr. Kitulu. We appreciate your presence here. So I welcome Dr. Were to give our closing remarks, and then we'll have one parting shot from each of our panelists as we end this meeting. Welcome, Dr. Were.
Thank you, Joy. I'd like to appreciate all the healthcare workers, especially the key workers who have spoken. I know as frontline healthcare workers, it's a matter of when and not if you'll get infected. And your stories have actually taught us a lot, and we hope to build and improve from what we've just had. And one of the key things I know Dr. Somba has touched on is the issue of communication. and stigma, especially healthcare worker to healthcare worker stigma. I think it's something that we need to organize a training and address this issue of soft skills, especially from how we break bad news to the fellow co-workers or colleagues. But also what is coming out is, I think we got the messaging about COVID-19 wrong from the beginning. We did not communicate well both to the public and to the healthcare workers. And that led to a lot of stigmatization. And I think we have an opportunity from just hearing what our colleagues were speaking about to actually correct that. And I'll also like to urge all the key workers in our institutions to actually take upon themselves to make their protection when their workplace a key priority. And this one, I'll speak directly to most of our administrators, whom most of them are our colleagues. That is time that we do take a stand on the issues of provision of the quality PPEs for all healthcare workers before provision of service. I know according to our oath, we are there to serve the public, but also we need to stop being pushovers and being forced to actually provide service without the proper protection, because it goes beyond the health institution. I'm sure most of us know actually most of our families which have been affected, who have been affected by the healthcare workers taking the been infected and affecting their family. Even Dr. Makove there was saying she was a bit worried if actually part of our family have actually contracted the illness, because she didn't know for a long while. So I think it's an appeal to the managers of the institutions. Please do your ultimate best to ensure that we have quality PPEs for all our healthcare workers. And related to that is also the issue that I think is a bit immoral, where we have some of our health institutions who have decided to cut the salaries of most of our workers. I think it's something that we need also to address. There's an issue also of the health insurance and protection of the healthcare workers after maybe the unfortunate or unforeseen circumstance they leave us. What happens to the dependents that they leave behind? And I think that is something that the Kenya Medical Association was working hand in hand with the Ministry of Health and KMPDU. And we hope we can follow it to conclusion, so that when we are working and providing services to the institution, then we might be, we should be at peace and should work knowing that you are giving our all to attend to the public, and at the same time, in the unfortunate circumstance that you get infected, then we are properly protected. So it goes beyond the dependent, it also goes towards the access to the testing. I know it's a difficult thing. Most of the healthcare workers in the institution that I do work, we are really struggling even to access the service, the testing services. So I think other than more than you can cover the healthcare workers, then you also need to cover them in terms of access to testing. And on the issue of testing, I think it's time we move to antibody-based kind of testing, because we'll be able to know quickly we've been exposed, and then take precautions to protect our loved ones back at home. Because the current testing regime that exists, where you test today and you get within 48 hours later the results, then does not serve in terms of helping us control this infection. And then lastly, I just want to emphasize on the issue of healthcare worker to healthcare worker stigmatization. I think we need to take the lead, because if we stigmatize a colleague, what do we expect when it's the member of the public who has been infected? Thank you. Joy?
Yeah, Joy. Joy seems to have dropped off, but Stanley, you can now take us home.
Yes, Prof. Thank you very much. Thank you, President Were, for your comments. This is just 30 seconds per panelist to just give us a parting shot as we close because we are behind time. I see Joy is back, but I'll continue shining on the throne that has been given. Let's start with Zedi. Zedi, your parting shot, please.
Thank you so much for giving me this chance. My parting shot will be, having tested COVID is not a death sentence. So I just want to encourage anyone who is watching, listening out there that you can make it. If we have made it, you can make it. So be positive. Try to think about the things that you can do at that time. Make yourself busy. Eat well, exercise. You know, do the things that you have not done for a long while. Those days, or my 21 days in isolation, has been a journey, but has been a very interesting one. I've managed to do so many things which I've not been able to do in the last maybe 3 or 4 years. And so I'm just encouraging anyone who is listening that you can make it.
Thank you very much.
Thank you.
Thank you, Zedi. If they have made it, you can make it. What an encouragement. Thank you very much. Let's hear, I see Austin has already dropped out of the call. Let's hear from Marilyn. Marilyn, 30 seconds to give your parting shot, please.
My parting shot, I think COVID is here with us. More health workers are being infected. Everybody goes through it as an individual, but what I would just wish those who are in isolation now is quick recovery. Don't take it like it is a criminal offense. It can get anybody, and we will be through it, because if I went through it and I was alone at that time from the public sector, I think right now there are many people. So we need to just encourage each other, especially the psychosocial support is very, very important, because everybody is struggling with it as an individual. So we just need to support each other and encourage each other that we will go through it and life must go on.
Thank you, Marilyn. Life must go on. It will come and it will leave. We have to be there for each other. Great, strong words. Dr. Jackie Irungu.
So thank you, Stanley. Someone mentioned the issue about, in the Q&A, and I took note, was the issue about children. And it was not addressed in this webinar. Maybe it's for another webinar, the psychosocial aspects. But I'm a parent, and one of my kids lives is that is the usual nasal discharge. That child has been fantastic. So I think to all the healthcare workers herein, I think a majority of you have children. I don't think you have to worry about children. Even reviewing the data from WHO and from my experience is that children do fantastic. Do not be worried. Dr. Stanley, I think the issue about healthcare worker testing and confidentiality is a whole different topic. I want to hold my comments for now, but maybe we can have another session for that. And I could share my experiences that I had in the TB program. TB being one of the most stigmatized diseases that we have had. Maybe we can share that maybe then, and then combine that with COVID. Thank you.
Thank you. Thank you very much. You already have a webinar, Dr. Mugambi, for next, and you have a panelist. Thank you, Dr. Irungu. Collins Ochieng, 30 seconds, parting shot, please.
Okay, what I would like to say, finally say that stigma is palpable, and we need to accept that this disease is here with us and it has to go. So if you are a healthcare worker and you know a colleague is having this problem, kindly support them. Thank you very much.
Thank you very much. I see Amakove is off the call. Allow me not to invite any other panelist in the interest of time, but just to say a few words and hand over to Mugambi to conclude. Thank you very much. Mark Twain once said, "The physician who knows only medicine knows not even medicine." And today we have demonstrated that probably we know more than medicine, and I hope we can continue with this. I posed as we were coming to the conclusion and wondered, what has this webinar gained? Then I went through the comments And so one comment, and I will quote it verbatim. Thank you for this forum. I am in isolation and this sharing has really helped me. This was from a healthcare worker. If that is the only thing to take from this webinar, for me, that is more than enough. It has been my great honor and privilege to moderate this session. And thank you very much. As I hand over back to Mugambi with the question, when next? I will leave you with the words of a very, very wise man who once said, good night. Over to you, Mugambi.
Thank you very much, Dr. Stanley. You have really summarized it in the best way. Mine is to only thank the panelists, our experts, and our attendees for holding on till these late hours. I know your suppers have gotten cold, but I would like to remind you we have lots of learning activities that go on our daily, throughout the week. We have the Pichakucha night. We have the Pichakucha night, and then the Pichakucha night is on Friday, which are division rounds. Then we have these mental health webinars, which are held every Tuesday here on Zoom or live on Facebook. Do join us and choose one of the modes that you'd want to join us with. Our next topic will be shared on our social media pages and our partners' social media pages. That's CPAK, the Kenya Psychiatric Association, the Nurses Association, and the Clinical Officers Association. You'll find this on the social media pages. We have come up with also the Tuesday COVID-19 case management webinars. Our first webinar was the home isolation guidelines, where I shared about how to home isolate. You can find this on our YouTube page of Kenya Medical Association. And you will also find the infection prevention control webinar, which was fantastically done by a wonderful team. I learned quite a lot in terms of infection control when it comes to COVID. And this is a webinar you need to share with your health workers, from the guy in the mortuary, from the guy cleaning, from the person who's at the gate. They need to hear about that webinar and learn from it. We also, the Pichakucha nights have shared that. We've traveled through the divisions, learned what they do in each county, gotten to see the processes that they are handling, from entry to exit of a patient within the hospital to the isolation facility, and learned a lot, as well as helped each division be able to set up its COVID centers and their hospitals in a much better way, and learned where the others are doing surgery. This has been an exciting journey within the divisions. We have the call center. Anyone wishing to reach out, do call 0800-720-608 from 9 a.m. to 10 p.m. Yes, challenges do appear. We are still in the learning process of running this call center, and your calls help us learn quite a lot. Do call in, do help us, give us feedback, because this is health workers helping other health workers. And if you do have even the opportunity to be able to help out in anything that is being done in terms of the healthcare practitioners, mental health and wellness, do reach out and we will be able to engage with you. Thank you. We have lots of learning resources on the website, which can also be downloaded. Have a good night. We appreciate your presence tonight, and take care. Safety begins with you and me. And with that said, do take care and be a friend to a friend. Do not stigmatize. I ask our panelists to please open their
video.
Their videos. Dr. Kigondu knows what he does after the webinars. And smile.
Yeah. Yes.
So Kigondu, you're through with.
Yes. I will sort out the videos. No problem. No problem.
Thank you. Have a good night,
Bye-bye.
everyone.
Thanks.
And stay safe.
Yeah.
Good night.
All right.
Good night.
Good night.